Welcome to our informative video on the 8 warning signs of blood clots you should know about. Blood clots are a natural response of the body to prevent excessive bleeding when an injury occurs. However, blood clots can also form inside blood vessels without any apparent injury, posing serious health risks. It is essential to recognize the warning signs of blood clots to seek immediate medical attention and prevent potential complications. In this video, we will explore the critical warning signs that may indicate the presence of blood clots in your body. Understanding these signs can help you take proactive measures and seek prompt medical care if needed. Blood clots can occur in various parts of the body, including the legs, lungs, brain, and heart. We will provide you with valuable insights on how to recognize the symptoms associated with these potentially life-threatening blood clots. Your well-being is our priority, and we aim to empower you with knowledge to protect your health and that of your loved ones. By being aware of these warning signs, you can take timely action and potentially prevent severe consequences. Before we delve into the warning signs, make sure to hit that like button and subscribe to our channel. By subscribing, you'll stay updated with our latest videos on health and wellness, empowering you to lead a healthier and happier life. Now, let's get started on this essential journey of awareness as we explore the 8 warning signs of blood clots you should know about. Number 8. Swelling. Swelling can be an important indicator of potential blood clots and should not be ignored. When a blood clot forms in a blood vessel, it can impede the normal flow of blood, leading to fluid retention in the affected area. As a result, swelling may occur, particularly in the legs, arms, or other parts of the body. The most common type of blood clot is deep vein thrombosis, DVT, which typically occurs in the deep veins of the legs. DVT can lead to swelling in one leg, causing it to feel larger and heavier than the other. However, swelling can also occur in other areas of the body, depending on the location of the clot. It is crucial to differentiate between mild swelling due to prolonged standing or sitting and sudden, unexplained swelling that may be associated with a blood clot. In cases of DVT, the swelling may appear without any apparent cause or injury. The affected area may feel warm to the touch and may be accompanied by pain or tenderness. Research and studies have shown that swelling is one of the most common symptoms of DVT and may affect up to 75% of individuals with this condition. Early recognition of swelling as a potential warning sign of a blood clot can lead to timely medical intervention and reduce the risk of complications. If you experience unexplained or sudden swelling in your legs, arms, or other parts of your body, it is essential to consult a healthcare professional promptly. Your doctor can perform a physical examination, order diagnostic tests such as ultrasounds, or recommend other imaging studies to confirm or rule out the presence of a blood clot. Number 7. Pain or tenderness. Pain or tenderness, particularly in the legs, is another crucial warning sign of a possible blood clot. When a blood clot forms in a vein, it can cause irritation and inflammation, leading to discomfort in the affected area. The type of pain experienced can vary from person to person. Some individuals may describe it as a dull ache, while others might feel cramping or soreness. The pain may be localized to a specific spot or may spread along the affected limb. In some cases, the pain might worsen with movement or when pressure is applied to the area. It is essential to recognize that the pain experienced with a blood clot may differ from typical muscle soreness or joint discomfort caused by physical activity. So, if you experience unexplained or persistent pain in your legs or other parts of your body, it is vital to seek medical attention promptly. A healthcare professional can conduct a thorough examination, evaluate your medical history, and order appropriate diagnostic tests, such as ultrasound or D-dimer blood tests, to determine if a blood clot is present. Number 6. Red or discolored skin. Red or discolored skin in the affected area can be a significant warning sign of a blood clot. When a clot forms and obstructs blood flow, it can lead to reduced circulation, depriving the surrounding tissues of an adequate oxygen supply. This lack of oxygen and nutrients can cause the skin to take on a reddish or bluish tint, depending on the severity of the clot and the location. Skin discoloration associated with blood clots is often more noticeable in the extremities, such as the legs or arms, where clots are more likely to occur. The affected area may appear red, warm, or flushed, indicating increased blood flow to compensate for the clot-induced blockage. Alternatively, the skin might show a bluish hue, known as cyanosis, due to the reduced oxygen levels in the tissues. It is crucial to differentiate this type of skin discoloration from other common skin issues or injuries that may cause redness or bruising. In the case of a blood clot, the discoloration may persist or worsen over time rather than fading like a regular bruise. Several studies and medical reports have emphasized the significance of skin discoloration as an indicator of underlying blood clots. Identifying and addressing blood clots promptly is crucial, as untreated clots can lead to severe complications, including damage to surrounding tissues and the potential for the clot to dislodge and travel to the lungs or other vital organs. If you notice unexplained redness or discoloration in your skin, especially in combination with other potential warning signs of blood clots, seek medical attention promptly. Number 5. Warmth to the touch. Feeling warmth in a specific area of the body could be a potential warning sign of a blood clot. When a clot forms and partially obstructs blood flow, it can trigger a localized inflammatory response, leading to increased blood circulation in the affected region. This heightened blood flow can create a sensation of warmth or heat on the skin's surface. It is essential to pay attention to this symptom, particularly when it occurs in conjunction with other possible signs of a blood clot. Warmth to the touch is often experienced in the legs, where deep vein thrombosis is more common. However, it can also occur in other parts of the body, depending on the clot's location. It is important to note that warmth alone may not always indicate a blood clot, as it can be caused by various other factors, such as inflammation, infection, or injury. However, when combined with other signs like swelling, pain, tenderness, or skin discoloration, the presence of warmth becomes more significant and should not be overlooked. Research and clinical studies have indicated that warmth to the touch can indeed be associated with the presence of blood clots. In a medical setting, healthcare professionals often use warmth and redness of the skin as visual and tactile indicators to assess for potential clotting issues. In some cases, the warmth may extend beyond the immediate area of the clot due to the increased blood flow and inflammation. If you experience localized warmth or heat in your body, especially if it is accompanied by other potential symptoms of a blood clot, seek medical attention promptly. A healthcare provider can perform a thorough evaluation, including a physical examination and diagnostic tests, to identify the underlying cause and determine the appropriate course of action. Number 4. Shortness of breath. Shortness of breath is a critical warning sign that should never be ignored, as it may indicate a life-threatening condition known as pulmonary embolism, PE. Pulmonary embolism occurs when a blood clot, often originating from the legs, breaks loose and travels to the lungs, obstructing the blood flow in one or more pulmonary arteries. This can lead to reduced oxygen levels in the bloodstream and can be potentially fatal if not promptly treated. The sudden onset of shortness of breath is a characteristic symptom of pulmonary embolism. Individuals experiencing PE may describe feeling breathless or finding it difficult to catch their breath, even when at rest or with minimal physical activity. This symptom often occurs suddenly and without any obvious trigger. Accompanying the shortness of breath, people with pulmonary embolism may also experience other symptoms such as chest pain, particularly with deep breaths or coughing, and a rapid or irregular heartbeat. These symptoms collectively indicate a medical emergency, and immediate medical attention is crucial. Research and studies have established that shortness of breath is one of the most common symptoms associated with pulmonary embolism. Various clinical trials have investigated the prevalence and significance of this symptom in patients presenting with suspected blood clots. If you or someone around you experiences sudden and unexplained shortness of breath, it is essential to seek emergency medical care without delay. Pulmonary embolism requires urgent treatment to dissolve or remove the clot and restore normal blood flow to the lungs. Delaying treatment may increase the risk of complications and can be life-threatening. Number 3. Coughing with blood. Coughing with blood, medically known as hemoptysis, is a concerning symptom that may occur in some cases of pulmonary embolism, PE. Hemoptysis is the coughing up of blood or blood-stained sputum from the respiratory tract, and it can be a sign of serious underlying conditions, including PE. When a blood clot travels to the lungs and blocks a pulmonary artery, it can cause localized damage to the lung tissue, leading to bleeding. The presence of blood in the respiratory tract can then manifest as coughing with blood. However, it's important to note that not all cases of hemoptysis are due to pulmonary embolism, as there are other possible causes, such as respiratory infections, bronchitis, or lung cancer. Nevertheless, when hemoptysis occurs in conjunction with other symptoms of pulmonary embolism, such as shortness of breath and chest pain, it becomes a more concerning and urgent sign. Research and studies have shown that hemoptysis is a less common symptom of pulmonary embolism compared to other manifestations like shortness of breath and chest pain. Nevertheless, when present, it can indicate a more severe and extensive clot burden in the lungs, warranting immediate medical attention. A comprehensive evaluation, including imaging tests like computed tomography, pulmonary angiography, CTPA, or ventilation perfusion, VQ scan, is crucial to confirm the presence of a pulmonary embolism and assess the extent of the clot. Timely diagnosis and management are essential in preventing potential complications and improving the prognosis. Number 2. Severe headache or dizziness. A blood clot in the brain, also known as a cerebral or intracranial clot, is a serious medical condition that requires urgent attention. When a clot forms in the blood vessels of the brain, it can obstruct blood flow and cause a range of neurological symptoms. Prompt recognition and medical evaluation are essential to prevent potential complications and minimize the risk of permanent damage. One common symptom of a blood clot in the brain is a severe headache. This headache may be different from typical headaches you've experienced before and can be intense and persistent. It might feel like a sudden and severe pressure or a throbbing sensation in the head. Additionally, the headache may be accompanied by other symptoms, such as visual disturbances, confusion, or difficulty speaking. Dizziness and problems with balance and coordination are also warning signs of a potential blood clot in the brain. These symptoms arise when the clot interferes with the normal functioning of brain cells and disrupts the communication between different areas of the brain responsible for balance and coordination. Studies and research have shown that immediate medical evaluation and intervention are crucial when these symptoms occur. A healthcare professional will perform a thorough neurological examination and may recommend imaging tests, such as a computed tomography, CT scan, or magnetic resonance imaging, MRI, to confirm the presence of a blood clot and assess its location and extent. The treatment for a blood clot in the brain may involve anticoagulant medications to prevent further clot formation, or in some cases, more invasive procedures may be necessary to remove the clot and restore blood flow. So don't ignore or dismiss these symptoms, as a blood clot in the brain can lead to serious complications, such as a stroke or permanent brain damage. Number 1. Chest pain. Chest pain can be a concerning symptom, and when it is persistent, sharp, and worsens with breathing or coughing, it could be an indication of pulmonary embolism or a blood clot in the lungs. The chest pain associated with a pulmonary embolism is often described as sharp or stabbing, and it may become more pronounced with deep breaths, coughing, or movement. The pain is typically localized to the chest area and may feel like a tightening or pressure in the chest. In some cases, the pain may radiate to the back or shoulders. Studies and research have shown that chest pain is one of the most common symptoms of a pulmonary embolism, but it is important to note that chest pain can also be caused by various other conditions, such as a heart attack, angina, or a respiratory infection. These symptoms may vary depending on the size and location of the blood clot in the lungs. Therefore, any persistent or severe chest pain should be taken seriously and evaluated promptly by a healthcare professional. And there you have it, the 8 warning signs of blood clots you should know about. If you notice any of the symptoms mentioned, especially if they are sudden or severe, seeking medical attention promptly is essential. Blood clots can be life-threatening if left untreated, but with proper medical care, the risk of complications can be minimized. If you found this information helpful, share it with your loved ones so they too can be aware of the signs and symptoms of blood clots. Remember to click the thumbs up button and subscribe to the Heart Health Coach channel, and ring the notification bell so you can be the first to know when our latest video comes out. Thank you for watching, and stay tuned for more valuable content on health and wellness.